Welcome and thank you for attending this joint stakeholder meeting via webinar. The date is August 12th, 2022, and the time is 10:03 a.m. We'd like to introduce the staff members who are present on the webinar today from the Division of Professions and Occupations. My name is Darcy Magnuson and I'm a regulatory analyst with the division. Also attending is Kathy Traugot, Deputy Division Director of Programs, Dimitri Kunin, Program Director for the State Board of Pharmacy, and Paula Martinez, Program Director for the Colorado Medical Board. I believe that's it for staff. We will let you know if any other staff members join us. And sorry, my bad, Elena Kemp, Regulatory Coordinator, who is helping us with the slides and facilitating the webinar. We also have Karen Phelan, who is the Program Director for the State Board of Optometry, the State Board of Podiatry, and also the Veterinary Board. And just looking to see if we have any other staff members who are here. We have Roberta Hills, who is the Program Director of the Colorado Nursing Board. That looks like that's it for now. So due to concerns regarding COVID-19, the division has transitioned to a platform that is 100% virtual. And so we appreciate your flexibility. As many of you have been to DORA stakeholder meetings before, we would like to reiterate the importance of your comments today. DORA makes decisions every day that may affect your life and your business, so your input is vital in the rulemaking process. Throughout this process, our goal is to create regulations that clarify and explain legislation, ensure minimum competency to enter and continue to practice, and provide only what is absolutely necessary for consumer protection without creating unnecessary barriers to the marketplace. Your input will be part of the information that goes to the board or the director as relevant, as the boards and the director consider adopting either revisions to implement Colorado House Bill 22-1284 or promulgate a new rule concerning the implementation of Colorado House Bill 22-1284, which is titled Concerning Updates to State Surprise Billing Laws to Facilitate the Implementation of Surprise Billing Protections and, in connection therewith, aligning state law with the Federal No Surprises Act. This meeting is being recorded and will be posted on each board and program's website by the close of business on Monday. As this stakeholder meeting is held solely by webinar, please raise your hand by using the hand icon if you would like to speak, and we will unmute your line so you'll be heard by everyone. Or you can type your comment into the Q&A section and we will read it aloud. Before we take comments, and we'll go into this some more once we go through the slides, but just as a general overview, when you do provide comments, please state your name and the name of the organization that you represent, if any. And feel free to provide either general comments on the new legislation or specific comments on the proposed language. And you'll see in the slides that we have some targeted questions about the proposed legislation and implementation into a new rule or updates to the rule that we're going to be asking. And we also ask that you keep your comments limited to 3 to 5 minutes or less and try not to repeat something that was already said. But you're welcome to state if you're in agreement with someone else, and we will note that. So we have the just general slide up right now about how to participate. Using audio through your computer, please remember to put any phones on vibrate or turn them off. And whether you are using computer or phone audio, try to keep background noises to a minimum when speaking. So Elena, sorry, if you can go back to the previous slide. So why we are here today. So this is a joint stakeholder meeting with the impacted boards and programs regarding the implementation of House Bill 22-1284, which I already read the title. So we're going to talk about just the general required rulemaking from that legislation, and then the current rules or status, ask for targeted feedback, and then talk about next steps. So you can go ahead and go to the next slide. As we mentioned, this meeting is being recorded. The purpose of that is to allow you to listen to it later if you want to provide additional feedback, and also to allow members who were not able to attend today to listen to the comments and provide feedback. Sometimes it's helpful to go back and hear what other people said. It'll trigger a thought for you to think of additional feedback. So that all will be posted on the board and programs website. Each board and program has its own website, and it's under the public notices tab. That's where we keep all information regarding rulemaking. So if you want to access this recording after today, you can look on your board or program's website under the public notices tab. So review of legislative changes in House Bill 22-1284. We will go through that and specifically talk about the required rulemaking. And then we'll receive feedback from you and answer any questions and discuss next steps as it relates to rulemaking. Next slide. Okay, so with respect to this legislation, this is the key section. So previously, and why I wanted to discuss the current status. So when this legislation was first passed by the legislature and signed by the governor, and it was 2019 or 20, it was 20, I can't remember the date. I think in my head I'm thinking 2019, but yes, it was 2019 because the requirement was for the beginning of 2020. So it required that the director, in consultation with the Commissioner of Insurance and the State Board of Health, adopt rules regarding healthcare providers. The issue with that was the director doesn't have the authority to make rules for the boards, for example, the medical board or the nursing board. Those boards house their own rulemaking authority. And so even though this was a requirement for healthcare providers, there was no authority to make rules. So you can see in the first line there, it was changed to the regulator, and by statute and definition in statute, the regulator includes both the director and the boards that have the rulemaking authority. So what was done previously is all of the director model programs where the director had authority. So programs like acupuncture, respiratory therapy, speech language pathology, the director did promulgate rules to implement that legislation. Those rules will need to be changed or modified based on this new legislation. And then the boards that did not have rulemaking authority are required to promulgate new rules to comply with this legislation. So we're on two different paths here, either updating rules or promulgating new rules based on these changes. You can also see here the scope of the rules. So the rules have to include consumer disclosures in accordance with, at a minimum, they must comply with the No Surprises Act, and we'll talk about that more when you see the draft rules. Next slide. Okay, so here are sample rules, and I included some comments in the rules about definitions. So we are required by statute to work with CDPHE and also with the Division of Insurance regarding these rules. So this rule proposed definition is consistent with Division of Insurance about publicly available, and you'll see why it's relevant once we get to the proposed disclosure, which mirrors the federal disclosure. But based on this, are there any other definitions that you think should be included in the rule as it relates to surprise billing? So we can pause here and give you a chance to look at this. And then we can always jump back, because I do have another question about definitions once we get to the sample disclosure. While we wait here, so this proposed language outside of the statement of basis and purpose, so the reason why the rule is being promulgated is the rule. The sample disclosure is included in an appendix. That's how the rules were drafted previously, and that's how they will be. We anticipate that they will continue to be in form. what you will know if you're one of the members of the professions who already have this rule, the legislation struck quite a bit out of the statute. And so this is the updated proposed rule. It's less in rule, and then it references the proposed disclosure. We've also dropped this into, I believe, Elena can correct me if I'm wrong, but we've also dropped this draft language into the chat. So you can access it as a PDF document, and you can see the entire document, which includes the appendix that we'll get to in the next couple of slides. And we'll also be posting it on all board and program websites for additional feedback. I'm not seeing any raised hands. So I think we can go to the next slide, Elena. So like I mentioned, the statute requires the disclosure to comply at a minimum with the No Surprises Act federal law. And so what we've done is they have, the federal government has released sample disclosures. So what we've done is incorporated those disclosures into our, what is Appendix A, or if it may be different for your board or program, but into an appendix. My question here on this side, so if you look at the federal disclosure, they link to definitions for co-payment, co-insurance, deductible. And so my question was whether people thought that those definitions should be defined in rule, because according to the requirements of the Secretary of State, we can't link in rule to other websites. So if we wanted to include those definitions, which are included in the sample disclosure, we would have to actually include them in the definition section of the rule. I'm not seeing anyone, Elena, so I think we can move on, and we'll leave those comments in there to continue to get feedback from stakeholders when we circulate these again. This is a continuation of the sample disclosure. And okay, we got a comment from an anonymous attendee that said, yes, include definitions. Thank you, that's helpful. So I included in the comment here what the Division of Insurance has in their draft. So I don't know what providers would like to see, so I left that as an open question for stakeholders, if anyone has any feedback on that. So we received an anonymous attendee. I'm not sure if I missed it, but is there a list of which provider types or places of service these rules apply to? And yes, that is included in the statute, the definition of healthcare providers. Molly Pereira, is dental included or is this strictly medical? Yes, dental is included. Dia Ingalls, what does emergency services entail? Emergency services is defined in statute. And then you can see here the sample disclosure also talks about emergency services. Elena, were you able to put anything in chat? It doesn't look like the documents were received.
Yes, I did. I will double check, but I tried to. It looks like it went through to everyone. You should be able to see the written comments from stakeholders received thus far for this House bill and a sample of the medical draft rules.
Okay, great. We did receive confirmation that they are there from an anonymous attendee.
Okay.
Wendy Watson, on here it says can't be balance billed and may not ask you to give up your protections. Am I reading this right? There are times when you cannot balance bill according to the statute. My suggestion would be to look at the entire statute and then to look at the corresponding rule. And then if you still have questions, you're welcome to reach out. I think if you look at them next to each other, they should make sense on when you can balance bill and when you cannot. Oh, Elena, so we're seeing that if someone joined late, they can't access what was in the chat. So if you can drop those documents in again, I think that'd be helpful.
Okay.
And once you're done with that, we can go to the next slide.
All right, just 1 second. While I would need to pause my screen just for 1 second.
Okay. Becca Pointer, we were told in 2019, 2020, when House Bill 1911-74 was created, and we had meetings that assistant surgeons could get consents to use an out-of-network provider assigned by patient prior to the date of surgery. Are you saying they can no longer do this? No, I'm not saying that. So the chat is disabled, but you should be able to receive the documents from us. If you do not receive the documents via the chat, you're welcome to follow up with us after the meeting and send an email to Dora_DPO_rulemaking@state.co.us, and we can send you the documents, or they will be posted on the board and program websites for you to access. From an anonymous attendee, for those of us who run small mental health practices, and also see patients, will you eventually create sample disclosures that we can use as templates to comply with these statutes? These regulations are onerous to small businesses who don't have the luxury of time to have a dedicated staff person keeping up to date with them. So the appendix that will be included with each of the proposed draft rules will have the sample disclosures in them. This is a section of the sample disclosure being shown on the screen, and it complies with the federal legislation. So you should be able to modify those to meet your practice needs. But yes, there will be sample disclosures. Looks like people are getting the document, so thank you for letting us know that. I think we can go to the next slide, Elena. Again, so I just left the language in there to see what people would want included in the draft disclosures. So we would appreciate any feedback on that. And you can always provide written feedback after today. I know I mentioned the email address. It's included on all of our notices for meetings. And that's where we receive feedback that we will then share with other stakeholders. We will also share that feedback with the board, the relevant board, and the director. So for some of the questions earlier, you can see on this part of the proposed disclosure when balance billing is not allowed. So I think that should help answer some of the questions that we had earlier. Anonymous attendee, does this only apply to certain physical settings like hospitals and emergency centers, or does it include private offices? It includes private offices as well. It's a requirement, so let me clarify that. So there are certain requirements. If you look at the statute, there are requirements for insurance, there are requirements for healthcare providers, and there are also requirements for facilities. So the statute breaks it down into within those three areas of the government. Have the components related to nursing homes and assisted livings been aligned? This is from Jenny Albertson, aligned with what is already required by HCPF and CMS. I'm not entirely sure what components you're referring to, but these particular disclosures are only regarding healthcare providers. You may want to check with HCPF and CMS about your question. Or if you want to give us some more information, we'd be happy to look into your question. Okay, I think we've gotten through all of the written Jeanette Barzy, when you go to the hospital for a surgery or emergency, they make you sign to waive these rights regarding balance billing. If you don't sign, you don't get seen. So saying they can't force you to agree to balance billing, but this is clearly coercion as one is in an emergency. They often present this as an electronic pad and say only that it is a consent to treat, which is not true. If you have concerns about whether someone is complying or concerns about the actual law, or if you have a concern about a healthcare provider, you're welcome to file a complaint with the division so the division can look into that. A general comment from an anonymous attendee. I haven't seen it on screen unless I missed it. Please make it clear when the notice has to be provided. I have been going for weekly PT and am given the notice before each visit. Is that necessary? Also make it clear whether patient signature of receipt is required. My suggestion would be, we didn't show it on the screen, but the statute is very clear on when the notice has to be provided. So I would suggest looking at the statute and the changes that were made in House Bill 22-1284. If you have questions after that, you're welcome to follow up with us. We will include, and we did include for today, the statute with the draft rules so that you can always take a look at that. I shouldn't say the statute, I should say the bill, so you can see the changes that were made by the legislature and how those are being implemented into rule. Joy Rasky for dental, what if you perform a service and when you bill out of that code, the service isn't covered by the in-network insurance carrier? Can you let the patient know this will be out of pocket and then charge the patient, or would you not be able to even charge the patient anymore? I think that if you have a specific question like that, you're welcome to reach out to us, but I think it's most important to take a look at whether you met the requirements of the disclosure, and if you have, whether you are able to balance bill based on that. So I think it would be best to take a look at the statute, what's required with the disclosure, take a look at the draft disclosure, and then from there see if your question is answered. Anonymous attendee, do these disclosures need to be signed? Yes. I will double check that, but I believe in the statute it says they do need to be signed. And we can pull up the bill just so that you can see it. I do think that may be helpful. And it's on page 19, I think, Elena, where it talks about the signature. But all of it starts on page 17, subsection 3.5. And that goes through the details on when you may balance bill. And then on page 19, it talks about the signature. Justine Maraldi, does this mean we should be billing the balance on the EOB provided to the patient? I am not sure I fully understand your question. And you're saying as an assistant surgeon. Anonymous attendee, where do we get clarity on the House bill? I know you keep saying to read it, but it seems to have some fuzzy areas and unknowns. It also seems like there is still a lot of confusion surrounding when a disclosure is needed or signed, or when you can have the patient waive their right. if you have specific questions on the statute that you think may need to be clarified in rule, you're welcome to send those to us. I'm saying to look at the statute because I think a lot of the questions that people have raised are laid out in statute. But if there's something specific in the statute that's unclear, or like you said, fuzzy, that you want to be clarified in rule, then the board or the director, they do have the authority to clarify the statute. So we would certainly want to hear from you about anything that may need additional clarification in rule. Sarah Fukuzawa, your hand is raised. I've unmuted you.
Hi there, my name is Sarah Fukuzawa. I'm a PA. I work for a surgical assisting third-party company. We were involved with some of the HB19-1174 Colorado bill, and I just wanted to get some clarification. I caught kind of the tail end of what Becca Pointer had brought up, just asking about the consents. I think there was a little bit of, I think when I read the bill in its entirety, it said that we can get consents and the patient can kind of give up those rights unless there's like no in-network people around. So I guess like my question is like in the case of someone like myself who's a surgical assistant, where there are no in-network providers for many of these carriers, is that consent still valid? And if so, you know, is the 72 hours or whatever that we have to give, is that still falling within the purview of the law?
That's a good question. I'll have to look into that. If you don't mind sending that into the rulemaking inbox, and then I can get some more clarification on it, I think that would be helpful. And if you
Absolutely.
want to specifically say what part of the statute is confusing,
Okay.
I would appreciate that. And for members who are listening today, you will post your comments, and so people can weigh in as well.
Thank you.
Thank you. Russell Thigh, what type of document is the CCR 71350? I have not been able to open it in Word, and it does not show as a PDF. That document is a draft of what the rules will look like, and it's the particular one, it's for medical board. If you need us to send it to you, you're welcome to send it to your question to the rulemaking inbox, and we can send it to you in a format that you can open, or it will be posted on the board and programs websites. Becca Pointer, it is not clear. I will reach out, but you said assistant surgeons could still get a consent signed to balance bill patients. Then the disclosure states that assistant surgeons cannot balance bill and cannot ask you to give up your right. Alina, I think you can go to the next slide. So next steps, continue to receive feedback. I think this is really important to get feedback on the proposed rule changes. If you have specific questions about how this legislation and these rules will impact your license, then you're welcome to reach out to us with those questions. But we really do need the feedback regarding the proposed rules so that we can take that feedback to the boards and the director for consideration prior to the adoption of the rules. And then we'll look at scheduling additional meetings meetings if necessary. What those meetings will look like is they'll be board or program specific. So this will be our only joint stakeholder meeting. And then from here, if we have to schedule additional meetings, it will be for the individual board or program to get targeted feedback regarding the implementation as it relates to those boards and programs. The rulemaking hearings, the dates will vary depending on the board. And so you can check the public notices tab on each board and program website. We also post all rulemaking hearings on the public calendar. And then we send out a blast email to licensees and interested stakeholders. So if you're not receiving emails for any reason, please reach out to us, but you will receive, if you're here today, you probably received the notice, or like I said, you can sign up on our website to receive rulemaking updates. In addition to being a licensee, you will receive them automatically. The answer, someone, anonymous attendee, did you answer Becca's question? I do not know the specific answer to her question. So I suggest, I know Becca said she was going to follow up with us. So I would ask you to follow up to the rulemaking inbox and I'll take a look at what you said and then get back to you on that. Okay, next slide, Elena. Any final questions as we work through this? And we'll go ahead and wait here for a couple minutes just to see if anyone else wants to ask any other questions. Becca Pointer, I have unmuted you. We should be able to hear you. Becca Pointer, you are unmuted on our end. If you unmute, we should be able to hear you. Okay, I see that you can't talk through your computer, so we will wait to hear or receive your written comment. While we do that, Justine Miraldi said, where are the sample consents? The sample consents are included in the draft rules as an appendix. So take a look at those. They were included in the document that was circulated via the chat. If you can't find them, let us know. Anonymous attendee, is this meeting just to go over the disclosure and additions? When is the final ruling of the disclosure or consents? So this meeting is to get stakeholder feedback regarding the proposed language to implement the legislation. From here, we will continue to get feedback, and then the boards and the director have the authority to adopt the rules or not. And then those will all be different hearing dates. So you'll have to check the board or program website that you're interested in because the hearing dates will vary. Becca Pointer, why is Colorado so quick to follow federal NSA when there is still 6 pending lawsuits? What are assistant surgeons because described as an ancillary provider when CMS has always stated they perform more than just ancillary services? I can't speak to the first question. The legislature passed this law to follow the federal NSA, and so we are required to implement the legislation. And I'm not sure I understand the second part about what are assistant surgeons, because described as an ancillary provider. I don't know that I fully understand that question. Don Tuttle, is the same disclosure Appendix A used for the consumer notice, provider notice, and facility notice? So there are my suggestion would be to look at you can Google them and find the sample notices from the federal government, and there are different notices. So they're not all the same. So I would take a look at those, and then you can also, like I said, CDPHE will be working on this as it relates to facilities, and the Division of Insurance is also working on it as it relates to insurance. So you may want to look at the other ones. And when does this law go into effect? It took effect earlier this month, and so now we have to get the rules in place in order to implement the law on our end. They went ahead and dropped the email address for the rulemaking inbox into the chat. If anyone wants to follow up with written questions or comments, you're welcome to do that. And we are asking for the specific questions that we pointed out in the draft rules, so that we can make sure that we get feedback from you. I'm not seeing any other questions. Actually, we have a raised hand. Mikhail Druzhinin, I'm sorry if I mispronounced your name. You are unmuted.
Yes, hi. My name is Mikhail Druzhinin, and I'm a surgical assistant here. And my understanding was that there was going to be some sort of like a checks and balance thing at some point where they, analyze like the negative impact of these laws, like on the consumers of insurance and the providers. Like, do we have like any data from any of this? Because I can personally tell you that over the last 2 years, my collections have, gone down probably 50%. And I can guarantee you that almost every single other surgical assistant is in the same exact boat, but nobody talks about like how this has negatively impacted the providers and also the patients, because the patients, they're paying more. It's not like they're getting saved money. Like they're paying more out of pocket, and we're making less money, and insurance is paying less. So when will there be some sort of data released on that?
So we wouldn't, Dora, we wouldn't have that information. So what we're required to do at this point in time is the legislature has required rulemaking, and this is all statutory. So I wouldn't have that information. You may want to reach out to your state representative or senator regarding some of your questions and what they considered as part of the legislative process. You can also listen into the entire legislative process and how this bill was ultimately passed on the state legislature's website, but we wouldn't have that information. I have a raised hand from Renee Karantinis. I've unmuted you. Renee, we should be able to hear you. Karantinis. I will go ahead and leave you unmuted. Anonymous attendee, I think what Becca is asking, why are assistant surgeons being categorized as an ancillary service when the CMS definition states that they are more than an ancillary service? This is stated in the disclosure. Anonymous attendee, is an in-network provider required to provide the surprise billing notice? As many times as I read the statute, I am still not sure. I think, if I'm not mistaken, that it is only regarding out-of-network providers. Becca Pointer, also with the federal NSA, we are already seeing assistant surgeons go cash pay only. The consumer who you want to protect, but they are being the most affected as now they are responsible for all the costs and claims are not billed to insurance. Insurance companies are not paying well, and arbitration is not a viable option as it is expensive and time consuming. If Colorado takes away the ability to have a consent signed to balance bill patients, I hope Colorado is aware how this will affect the consumers under the jurisdiction of Colorado. Renee Karatunis, we still have you unmuted.
Yeah, can you hear me?
Yes, we can hear you.
I'm so sorry about that. I'm just going to ditto the surgeons. I'm a specialty provider. And as a provider for non-emergency services, making decisions to be out of network typically is that an insurance company is capitating reimbursement and that reimbursement doesn't cover the cost of services. Insurance companies collude, they capitate, they price fix. United Healthcare hasn't given our providers, for example, a rate increase in over 21 years, even with Medicare patients, when services are allowed, nonsense like, that's duplicative or this or this. So a provider's time is worth more than that. We want to spend time with our families too. And so we make a decision to be out of network. And when we can free care so many patients, and we certainly do, but in specialty, there's no place to refer a patient to. It's the saddest thing I've ever seen, the results of this legislation. The patients are being hurt, they have no place to go, and they're paying through the nose for insurance. This year, insurance companies, as a response to this legislation, are now really up to no good. They're colluding, they're requiring out-of-network providers to obtain authorizations, not approving those services, capitating them, price fixing. Once again, sadly, the patients are being harmed. We work with a lot of ALS patients. There's nowhere to send them. Patients, providers can't continue to free care patients ongoing. This legislation always seems to sway the way of insurance companies. And at what point do rulemakers and others start to give providers a voice? Most providers are not in this business to make $1 million. They happen to have care about people, and that's why they're providers. So some of these schemes that they're up to, once again, colluding with, how do we report colluding? How do we report, besides our, senators and legislators that don't seem to understand us, is that the Division of Insurance, the intent of the rule has already backfired. We have no place to refer them to, and they're going without services.
Thank you for being here for today and providing your feedback. So we do have, it sounds like you have some questions for the Division of Insurance, and so they do have a complaint process as well. And with respect to the legislation, like I mentioned earlier, we are required, the boards and the director are required by the state legislature to implement the law and don't have the authority to change the law. So in some ways, our hands are tied regarding this. If you have thoughts or questions or ideas on how the law could be implemented as it relates to healthcare providers, please send those in to us. Because that's the purpose of this implementation in this meeting today.
I think I do. I think that it is, can we include insurance companies, with some rules around that. I mean, requiring and authorizations, and when you're out of network, disclose, don't exceed CMS, follow all the rules. As a family ourselves, we pay $36,000 a year for insurance, and go through the same stuff. So there needs to be some inclusion of language to encompass this, nonsense that's going on between, Blue Cross, United, these different insurance companies, and to not give them the free ticket to do these kinds of things, because ultimately in the end, it's the patients that are hurt.
Okay, well, as far as the rules that are up for consideration by the boards and the directions within the Division of Health, within the Division of Professions and Occupations, the disclosures relate to what a healthcare provider is required to disclose to a consumer. So I'm not sure that we would be able to answer the question about insurance within with these disclosures, but the Division of Insurance is also implementing this law, so it may be helpful to see what they are implementing and then to ask any questions that you might have to them.
So a patient's recourse would be to complain to the Division of Insurance?
That's one. I mean, because I'm not as familiar with Division of Insurance, so I work only within the Division of Professions and Occupations. But yes, I believe that is the case. And so that's why we were showing earlier. So we're working with the Division of Insurance on this. The statute requires it. And we're trying to make the disclosures as similar as possible, but they will be a little bit different. And one of the things that we were showing is where you can reach out to the Division of Insurance.
Thank you.
Yeah, in their disclosure that will be required as well. So.
Thank you.
Thank you. An anonymous attendee, but the implementation of the law is up for argument. I'm not sure I quite understand that. The implementation is required. It may be that the contents of the law seem to be like they're up for argument, but the actual implementation of the law is required, and the legislative grant for rulemaking authority is set forth in the law. Anonymous attendee, the bill has required negotiation with the carrier, yet the carrier refuses to negotiate, and then they state that we need to take them to arbitration. They don't have any rules around insurance carriers. So trying to redirect, this is not we don't have any authority over the carriers. So this particular meeting and this legislative implementation relates to the requirements for healthcare providers that are required to be disclosed to the consumer, to the patient. Mikhail Druzinin, I believe we heard from you, but your hand is still raised, so I want to make sure we didn't miss anything else. So I've unmuted you if you wanted to add anything else. Okay, looks like you lowered your hand. All right, I'm not seeing anyone else. So I'm going to go ahead and wrap up and we'll take a quick look. Anonymous attendee, the director stated last House bill, the implementation of the bill is up for discussion and we can create rules around it. Okay. Maybe you can provide some more information about that, since you put that in quotes that the implementation of the bill is up for discussion. Yes, the implementation of the bill and what can be included in rule as permitted by the legislature is up for discussion. So the draft rules that we dropped into the chat, we can receive feedback on those, but the director and the boards do not have the authority to change the law. So thank you for participating in today's meeting. The stakeholder comments and program recommendations will be presented to each board or director before the rulemaking hearings. The dates of the hearings will be emailed to licensees and stakeholders and posted on each board or program website and calendar closer to the dates of the hearings. Sorry, I was just checking the Q&A one more time, and we did receive another comment from an anonymous attendee. They do have the authority to create rules to implement the gray areas of the law. That is absolutely correct. So if there, and that's what I mentioned earlier, if there, someone had said there were fuzzy areas of the statute, if those need to be clarified or explained in rule, then the director and the boards do have the authority to clarify and explain the legislation. They just can't change the legislation. So that concludes our stakeholder meeting, and we are going to go ahead and end the webinar now.